we're always told to watch our weight,
Yeah.
especially as we get older.
Yeah.
But get this chapter we're looking at from Interdisciplinary Nutritional Management and Care for Older Adults.
Mm-hmm.
It suggests that weight loss might not always be the best approach for older adults.
Interesting.
So we're going deep on chapter 16.
Okay.
Obesity in older adults.
Right.
And maybe changing how we think about aging and well-being in the process.
Sounds like a good plan.
Yeah.
It is fascinating, because this chapter, it really challenges those assumptions about weight and health, especially as we age.
Okay.
We're going to explore how aging changes things.
Yeah.
And how focusing just on weight loss, that might not be the whole picture.
Got it. So first things first, how are we defining obesity in older adults?
Right.
Is it the same BMI chart we're all used to?
Well, not quite. I mean, we often hear, 30 or higher on the BMI chart.
Yeah.
That means obesity.
Yeah.
But for those over 60, this chapter suggests that might not be the most accurate way to look at it. It's like your body in your 70s.
Mm-hmm.
Could weigh the same as it did in your 40s,
Okay.
but with a lot less muscle and a lot more fat.
Interesting. So it's not just about what the scale says, but like what makes up that number.
Yeah, exactly. It's about body composition.
Right.
And how that changes as we age. The chapter even suggests a different BMI range for older adults,
Okay.
somewhere between 23 and 30,
Got it.
potentially more accurate. And it highlights, too, how common obesity is in this age group. Like in the U.S., back in 2014, 38% of men and 39% of women.
Wow.
Over 60 were classified as obese.
Those are some big numbers. So
Right.
we need to understand how aging affects our bodies, not just like weight gain.
Absolutely. Beyond just the weight gain.
Yeah.
Because as we get older, we naturally lose lean body mass,
Okay.
bone mass and body water.
Yeah.
And we tend to gain fat. But it's not just about the extra pounds. It's where the fat goes in our bodies.
Okay. So the fat is redistributing.
It is, yeah, redistributed.
Tell me more about that.
So instead of being spread out evenly, it tends to concentrate in the abdominal region
Yeah.
around our organs. This is what we call visceral fat.
Okay.
And it's linked to a whole lot of health issues.
Okay.
Meanwhile, we lose subcutaneous fat. That's the kind under our skin,
Oh, okay.
in other areas.
Okay.
And we even see fat building up in muscle, the liver, and the heart, which is obviously not good.
So it's like not just how much fat we have, but where it is in our bodies.
Exactly.
Okay.
And this brings us to something called sarcopenic obesity,
Okay.
which is like a double whammy.
Okay.
It's excessive fat,
Yep.
along with decreased muscle mass.
Got it.
And this combination really raises the risk for all kinds of health problems.
Yeah.
You lack the strength and mobility that comes with having healthy muscle mass.
Okay. Now that you mentioned muscle mass, I remember reading about like being overweight and malnourished at the same time.
Right.
Is that connected at all?
You're thinking of DOOM,
Mm-hmm.
the diagnosis of overweight or obese malnutrition. So imagine someone who appears overweight, but isn't getting enough nutrients.
Yeah.
That's the challenge of DOOM. And it really shows how weight alone doesn't tell the whole story.
Right.
Both DOOM and sarcopenic obesity, though, they involve weight issues and nutrition concerns.
Okay.
But sarcopenic obesity is specifically about age-related muscle loss,
Mm-hmm.
whereas DOOM can happen at any age.
Got it. So we've got this, complex picture of the aging body changing.
Yeah.
But what's causing this increase in obesity in the first place? I mean, is it just like too many calories, not enough exercise, or is there more to it?
Well, at its core, yeah, it is an energy imbalance.
Yeah.
You're taking in more calories than you're burning.
Right.
But we have to think about how societal trends add to that. We're surrounded by energy-dense food,
Yeah.
high fat, high sugar, and our lifestyles are so sedentary.
It's like we're programmed to gain weight.
Right.
We drive everywhere, we sit at desks all day, and even our leisure time is like on screens.
Exactly. Yeah. And then aging just adds another layer to it.
Right.
Our bodies become less efficient at burning calories.
Okay.
And we tend to burn carbohydrates for energy, not fat.
Interesting.
So this, combined with less physical activity, makes it even easier to gain weight.
So it's our environment and our biology kind of working against us.
It really is.
And I'm guessing it's not just about like fitting into our genes anymore.
No.
There are some serious health risks, right?
Absolutely. Obesity triggers all these physiological changes in the body.
Okay.
Think insulin resistance, hormonal shifts,
Mm-hmm.
changes in how growth factors work,
Right.
increased blood lipids, and more inflammatory molecules.
Wow. So all of that is going to increase our risk of chronic diseases.
Yes. It increases the risk of things like cardiovascular diseases, diabetes, and even certain cancers.
Like what kinds of cancers are we talking about?
We're talking about things like endometrial, breast, ovarian, prostate, liver, gallbladder, kidney, colon cancer.
So it's a pretty long list.
Yeah, it is.
And it's not just those major diseases, right? Obesity affects, like, our joints, our mobility.
That's right. It increases the risk of osteoarthritis, particularly in the lower extremities.
Okay.
So it makes it harder to move freely and maintain independence as we age.
Yeah.
It can really impact quality of life.
So far, everything points to weight loss being the solution.
Yeah.
But now we get to this obesity paradox you were talking about. This is where things get a little confusing for me. So
Yeah.
you're saying that sometimes being obese might actually be protective.
It does sound counterintuitive,
It does.
but studies have actually shown that some patients with serious conditions,
Yeah.
like coronary artery disease,
Okay.
heart failure,
Mm-hmm.
type 2 diabetes, even chronic kidney disease,
Wow.
they might actually have a lower risk of dying if they're obese.
Okay, now my mind is officially blown.
Right.
Why would being overweight be beneficial in these cases?
There are a few theories. Some suggest that obese individuals have more nutritional reserves that they can draw on when they're sick.
Interesting.
Others say they might have better hemodynamic stability or higher bone mineral density,
Mm-hmm.
which could be protective.
Got it.
And then there's the idea that hip fat could actually cushion falls, reducing fractures.
So like the extra weight is kind of a buffer in those situations.
It could be, yeah.
It's still kind of hard to wrap my head around, but it's fascinating to think about.
It is, and it does challenge our assumptions.
Yeah.
But we should remember, too, that the obesity paradox is still being debated.
Right.
A lot of scientists say there might be biases in the studies, or that BMI isn't always accurate,
Okay.
especially in older adults who've had so many changes in their body composition.
So where does this leave us? I mean, if the obesity paradox might be flawed,
Yeah.
and obesity has all these negative consequences,
Right.
shouldn't weight loss still be the goal for older adults?
That's where things get a little bit complicated. Because traditionally, weight loss has been seen as a good thing. But there's a growing concern that it could speed up muscle and bone loss in older adults. And those are already concerns as we age.
So are you saying weight loss could actually do more harm than good in older adults?
Not necessarily. There's a lot more research coming out that's suggesting a more nuanced approach.
Okay.
Recent studies have shown that controlled weight loss, combined with enough protein and exercise, can have really positive effects.
So it's not about like crash dieting,
Right.
more of a balanced approach.
Exactly.
Okay.
So these studies are finding improvements in things like weight and fat mass, physical functioning, quality of life, pain reduction, and even blood sugar control.
This is giving me some hope. So there is a path to weight loss for older adults.
Yeah.
That's safe and effective.
There is.
But it makes me wonder, are these positive changes really because of the weight loss itself?
Right.
Or is it the lifestyle changes that come with it?
That's a great question. And it's one of the toughest things researchers are trying to figure out when they study weight loss. It's so hard to separate the impact of weight loss from other things, like increased physical activity or a better diet.
Right, because if you're exercising more and eating healthier, you're obviously going to see some positive changes.
Of course.
But how much is because you lost weight?
Yeah.
And how much is just from being healthier overall?
That's the million-dollar question. Some experts even say that losing a small amount of weight, like around 5 kilograms, might be less impactful than simply increasing physical activity.
Yeah, that makes sense. It's a lot easier to commit to like a daily walk than to completely change what you eat.
Right.
But what about all the research we hear about weight loss and like living longer? Doesn't that say that losing weight helps you live longer?
Well, there's a meta-analysis on intentional weight loss and mortality in older adults
Okay.
that kind of sheds some light on this. And overall, it did find that weight loss was associated with a 15% reduced mortality risk.
Okay, so that sounds like pretty good evidence for weight loss.
Yeah.
Case closed?
Well, not quite. Yeah. When they looked closer at the individual studies within that meta-analysis, a really interesting pattern came up: the reduced mortality risk.
Okay.
It mostly came from studies that included exercise as part of the weight loss.
Ah, so it's back to that combined approach again.
It is, yeah.
Moving more and eating mindfully.
Exactly.
Seems like the magic formula. What about the studies that focused on diet alone for weight loss?
Well, that's where things get really interesting.
Oh, yeah.
Those actually showed a slight increase in mortality risk,
Oh, wow.
but it wasn't statistically significant.
So not only might losing weight without exercise not help,
Yeah.
it could even be harmful.
Potentially, yeah.
Yeah.
It definitely raises some concerns.
So those restrictive fad diets are probably not a good idea.
Right. And you also have to think about the challenges of keeping that weight off over time.
Yeah.
It's really hard. And then you have the potential for yo-yo dieting,
Right.
which has its own risks.
It seems like we're kind of at a turning point in how we think about obesity in older adults.
I think so, yeah.
If weight loss isn't always the answer, what should we be focusing on?
I think the key is shifting our focus from just weight loss to healthy aging overall.
Okay.
It's a more holistic approach, looking at the whole person.
I like that. So less about fitting some ideal
Right.
and more about creating a lifestyle that's sustainable for the long run.
Exactly.
So what would that look like practically?
Well, for one, we need to recognize that physical activity is crucial.
Yeah.
We need to encourage older adults to be doing both resistance training, like weightlifting,
Okay.
and aerobic exercise, like for brisk walking or swimming.
So building strength and stamina.
Mm-hmm.
But why is exercise so important, especially for this age group?
Well, it's not just about burning calories or fitting into certain clothes. Exercise, especially strength training, helps to preserve and even build muscle mass,
Okay.
which is super important for staying functional and independent as we age.
Yeah.
And for overall health, too. It's the best way to fight sarcopenia, which we were talking about earlier.
Makes sense. We need those muscles to keep doing the things we love as we get older.
Right.
What about the nutrition side of things?
Well, along with exercise, we have to think about diet quality,
Okay.
making sure older adults are getting enough protein, eating a variety of fresh foods, and trying to fit more weight gain.
So it's kind of a two-pronged approach.
Yeah.
Move more, eat better. But it sounds like you're suggesting more than just general advice.
I am, yeah.
It's more about personalized plans. Right?
Exactly. We need to move away from that one-size-fits-all mentality.
Yeah.
Healthcare professionals should be considering things like motivation, attitudes, cognitive function, support systems, and even financial constraints before they even suggest weight loss.
So meeting people where they are and helping them make changes that are realistic for them.
Absolutely. And we haven't even talked about the challenges faced by older adults with conditions that limit their mobility.
Like stroke or arthritis.
Exactly, yeah.
That adds a whole other layer of complexity.
It does. Imagine having a condition that makes it hard to move,
Yeah.
and then that limitation makes it harder to stay active,
Right.
leading to weight gain and further decline. It's a tough cycle to break.
It sounds like we need more research on how to help older adults dealing with those kinds of challenges.
We absolutely do. There's a lot of work to be done to come up with weight management strategies specifically for them. For example, some researchers are looking into high-protein diets for people with mobility issues.
It's amazing how much we're learning about aging and its impact on our bodies.
It is.
I feel like we've really busted some myths about obesity in older adults today.
Definitely. It's not as simple as lose weight, be healthy.
Right.
It's about understanding the changes that come with getting older, the potential downsides of weight loss, and the importance of a holistic approach that focuses on physical activity, nutrition, and well-being in general.
I think our listeners have a lot to think about after this.
I hope so.
Before we move on, was there anything in this chapter that really stood out to you? Something you found particularly insightful or surprising?
You know, one of the most interesting points for me was the emphasis on a life course approach to preventing obesity.
Okay. What does that mean exactly? Like starting healthy habits early?
Yeah, it's the idea that the foundation for our health is laid throughout our entire lives,
Okay.
not just in our later years. The habits we develop early on can really influence our risk for things like obesity and other health issues as we age.
So it's not just about what we do as older adults, but the choices we make over time.
Exactly.
That's powerful.
It is. And it highlights the need for prevention at different levels. Individual, family, community, and even societal. We need to make it easier for people to make healthy choices.
That makes sense. It's easier to make those choices when they're available and affordable.
Right.
But what about older adults who are already obese? How does this life course approach apply to them?
Well, the chapter challenges the idea that weight loss should be the automatic goal
Okay.
for all older adults, especially those who are overweight or mildly obese.
That goes against everything we've been taught.
It does. It's almost radical to think that weight loss might not always be the answer. There's definitely a shift in thinking, and it's really important to say that this advice should always be personalized,
Yeah.
talked about with a healthcare professional, and tailored to individual situations.
Okay.
But the authors make a really strong argument for prioritizing health and well-being
Right.
over just focusing on the number on the scale.
So shifting the focus from weight loss to healthy aging,
Yes,
not ignoring weight, but understanding it's just one piece of the puzzle.
exactly. And for some people, that might mean keeping their weight stable.
Okay.
For others, it might be about preventing more weight gain. And for others, it might mean pursuing very gradual weight loss
Okay.
under the guidance of a doctor.
And this goes back to how important physical activity and a balanced diet are
It does, yeah.
for everyone.
Regardless of weight.
Right.
The chapter really stresses that those two things are essential. They recommend both resistance and aerobic exercise to improve or maintain physical functioning, independence, and overall health. And when it comes to nutrition, they recommend working with a registered dietitian or another qualified professional to come up with a personalized plan that makes sure you're getting enough protein and a variety of fresh, whole foods.
It seems like the big takeaway is that we need to be more nuanced and individualized in how we approach weight management in older adults.
I think so, yeah.
I'm curious, at the end of the chapter, there's a section called Take-Home Points. Did those resonate with you at all?
They did, yeah. They really summarize the message of the whole chapter.
Okay.
For example, they say that a life course approach to preventing obesity should be the focus for all healthcare providers,
Okay.
which means starting early and promoting healthy habits throughout life.
So building a culture of wellness from the beginning.
Right.
What else did they say?
Well, they made a pretty bold statement. They said that overweight, older adults shouldn't routinely be trying to lose weight
Okay.
unless a doctor tells them to.
Interesting.
That really goes against the idea that everyone needs to be striving for a normal BMI.
So acknowledging that weight is just one factor,
Yeah.
and it might not be the most important one,
Right, especially as we age.
especially as we age.
They also addressed obese older adults,
Yeah.
saying that they might not benefit from just changing their diet to lose weight. Again, this isn't a blanket statement.
Right.
It's a call for being careful and making decisions on a case-by-case basis.
It really emphasizes that weight loss isn't the answer for everyone,
It's not, no.
even those classified as obese. What about exercise?
Well, they said that any attempts to lose weight should be done with appropriate physical activity
Okay.
and careful monitoring of muscle strength and function.
That makes sense. Making sure that if you are going to lose weight, you're not sacrificing muscle and bone density,
Exactly.
which are so important for healthy aging.
They are. And they actually said that weight loss might be harmful in older adults.
Wow.
Even if it's intentional.
Yeah.
It's a reminder that we need to be cautious and thoughtful when we're talking about weight management in this population.
Yeah.
It's not without its risks.
Especially if it's done through those restrictive fad diets.
Right, which they specifically advise against.
Yeah.
They emphasize that there's no place for those quick fixes
Right.
that are often not even nutritionally sound.
Yeah.
It's about building healthy habits that last.
Not chasing the latest trends. This chapter has really made me rethink how we approach weight and aging. One of the most valuable things I've learned is how to reframe obesity in older adults.
Yeah.
It's not just about the number on the scale,
Right.
but about overall health and well-being.
I completely agree. It's about moving past the stigma and judgment that often comes with weight
Yeah.
and focusing on what really matters, helping older adults live full, active, and fulfilling lives.
And that might mean losing weight for some people.
It might, yeah.
But for others, it might be about maintaining a stable weight or preventing more gain or just focusing on improving their physical functioning and quality of life
Exactly.
through things like exercise and a good diet.
It's recognizing that there's no one approach that works for everyone,
Right.
and that personalized, evidence-based guidance from a qualified professional is key.
This has been such a great conversation.
It has.
We've learned so much about obesity in older adults.
We have.
But what are some of the biggest questions that we still need to answer?
Well, one of the most important ones is understanding how weight loss, muscle mass, and bone density all work together.
Okay.
We need to figure out how to promote weight loss
Yeah.
if it's needed
Yeah.
in a way that doesn't affect those things.
So it's not just about losing weight, it's about losing the right kind of weight.
Exactly.
Another important area is developing weight management strategies for older adults who have limited mobility. That group faces such specific challenges.
They do, yeah.
And we need to find safe and effective ways to help them.
We do.
And of course, there's still the debate about the obesity paradox.
Right.
We need more research to understand it.
We do.
Yeah.
And we can't forget about the emotional side of weight management in older adults either.
Yeah.
How do we deal with the stigma and shame?
Right.
How do we promote body positivity and self-acceptance while still encouraging healthy habits?
Those are all such important questions, and it's clear that we have a lot to learn. But this deep dive has given our listeners a more informed perspective on this issue.
I agree. It's about starting a conversation, challenging assumptions, and encouraging a more holistic and individualized approach to weight management for older adults.
It's amazing how much we've learned. Really challenged some of those old ideas about weight and aging.
Yeah, it's been really interesting.
But let's shift gears a bit now.
Okay.
And talk about what all this means for you.
Right.
What can you do with this knowledge to, navigate weight management and embrace healthy aging?
Well, one of the most empowering things you can do is find a healthcare provider who gets it,
Okay.
who specializes in geriatric care and understands the nuances of weight management for older adults.
So not just any doctor,
Right.
but someone who really understands the needs of this age group.
Exactly. Someone who can assess your individual needs,
Yeah.
create a plan just for you,
Mm-hmm.
and monitor your progress safely. They'll look at your medical history, your lifestyle, your goals.
It's like having a personalized roadmap for your health.
It is.
And I imagine a registered dietitian could be a valuable resource too,
Yeah, absolutely.
especially when it comes to making changes to your diet.
Right. A registered dietitian can help you make sure you're getting enough protein, all the nutrients you need,
Okay.
and a variety of fresh foods. They can also help you sort through all the conflicting information out there about nutrition.
It's like having a personal nutrition coach.
Yeah.
Now, what about resources for physical activity? Where can older adults find safe and effective exercise programs?
There are so many options these days,
Okay.
both online and in your community.
Right.
Lots of senior centers offer exercise classes specifically designed for older adults.
Okay.
And you can also find personal trainers who specialize in working with this age group.
And for those who'd rather exercise at home, there are all those videos and online programs.
There are tons. The key is to find something you enjoy.
Yeah.
But that's also appropriate for your fitness level.
Right.
And any limitations you might have.
Yeah.
Start slowly and gradually increase how hard and how long you work out. And always listen to your body.
Okay.
If something hurts, stop and talk to your doctor.
So finding activities you actually look forward to,
Right,
that you can stick with. Exercise shouldn't feel like a chore.
Exactly.
Yep.
And don't forget about just adding more movement to your daily life.
Right.
Take the stairs, park farther away, walk the dog an extra block.
Yeah.
Those little things can really add up.
It's about making movement a natural part of your day.
It is, yeah.
Speaking of routines, we can't forget about sleep,
Oh, absolutely.
especially as we get older.
Sleep is crucial for overall health and well-being. And it plays a big role in weight management, too.
Really?
When we don't sleep enough, our bodies produce more cortisol.
Okay.
That's the stress hormone.
Right.
And it can lead to increased appetite and more belly fat.
So getting enough sleep can help with weight management.
It can, yeah.
That's a good reason to prioritize it.
It is.
Any tips for improving sleep as we age? I know it can be tough.
Well, having a regular sleep schedule is key, even on weekends.
Okay.
Try to go to bed and wake up around the same time each day. That helps keep your body's natural clock in sync.
Got it.
And having a relaxing bedtime routine can help signal to your body that it's time to wind down,
Like what kinds of things?
like taking a warm bath,
Okay.
reading, listening to calming music.
Those all sound lovely, and I'm guessing limiting screen time before bed is important too.
Absolutely. That blue light from our devices can really interfere with our sleep.
Right.
Aim to power down all screens at least an hour before bed.
We've covered so much good information.
We have.
Finding the right healthcare providers, moving more, prioritizing sleep. But I think we should talk about the emotional side of weight management too.
Yeah, that's a great point.
This can be a really sensitive topic,
It is.
especially for people who've struggled with their weight for a long time.
It's so important to approach weight management with compassion
Okay.
for ourselves and for others.
Right.
Weight is just one aspect of a person's health and well-being.
Mm.
and it doesn't define their worth.
It's about moving away from the shame and judgment and focusing on self-care and acceptance.
Exactly. And remember that progress, not perfection, is the goal.
Okay.
There will be setbacks. That's normal. It's about learning from them and keeping going.
It's about celebrating those small victories along the way. Walking an extra 5 minutes, choosing a healthier meal, getting a good night's sleep. Those all make a difference.
They really do.
Yeah.
And remember, you don't have to do this alone.
Right.
Reach out to your loved ones, your healthcare providers,
Yeah.
or join a support group.
Okay.
There's strength in community. There are people out there who get it.
That's a great message. We're all in this together. So as we wrap up this deep dive into obesity in older adults, is there one key takeaway you want our listeners to remember?
I think the biggest thing is to embrace a holistic approach to healthy aging.
Okay.
One that goes beyond the number on the scale.
Right.
Take care of your body with movement, good food and rest, and be kind to yourself along the way.
I love that. We hope this deep dive has given you the knowledge and inspiration you need to really take charge of your health. Thank you for joining us. And remember, we're always here to support you.
Always.